Picture this. You're walking down the street like any other normal day, and then BAM! You see someone collapse. You inspect the situation further, and you notice that they're unconscious and they're not breathing. What's going to be your response? Are you going to panic, or are you going to spring into action? Today, I'm going to be giving you the knowledge of basic first aid and potentially the knowledge to save somebody's life. As a nursing student, basic first aid is the building blocks and the foundation of just about everything that we do. As a fellow college student, a lot of us get the mentality, myself included, of that'll never happen to me, that can't happen, that won't happen. And the reality is you just don't know. You should always be ready to jump into action for yourself, a loved one, or even a stranger. So that's why today I'm going to be explaining what basic first aid is, how to implement a couple basic first aid techniques, and what you should keep in a basic first aid kit. So first, what's first aid? First aid refers to the initial assistance provided when someone becomes suddenly injured or ill. The overall goals of first aid are to prevent further harm, possibly prevent further complications, and keep that person stabilized until medical professionals can arrive and assist. The awesome thing about first aid is anybody can do it. However, it is important to know which basic first aid techniques should be used in which situations. So let's talk about some techniques. Cardiopulmonary resuscitation, or CPR, is one of the most critical life-saving skills. The American Heart Association, or the AHA, suggests that after a cardiac arrest, a person's chances of survival decrease by 10% every minute without intervention. The AHA also states that performing initial CPR can double or even triple a person's chances of survival. To perform CPR, you want to press down firmly on the chest of the person that you're performing CPR on, at least 2 inches deep, and at a rate of 100 to 120 compressions per minute. If you're trained to do so, rescue breaths are very, very important to give. Next, let's talk about some bleeding strategies. If a person just has a minor bleed, applying direct pressure should help stop that bleed. If a person is bleeding profusely, you want to elevate that limb, if you can, and provide pressure with a clean cloth. Now, if a person is experiencing extreme bleeding, the use of a tourniquet can be so helpful. You want to apply the tourniquet above the limb that's bleeding, and that should help to cut off some of the circulation and stop that bleed. The Mayo Clinic states that the use of tourniquets is wonderful because tourniquets avoid the disruption of a forming blood clot and can make for easier patient transport when medical professionals arrive. Now, let's talk about choking. Choking is going to be one of those situations that you'd probably most find yourself in. If you don't already know, there's a universal sign for choking, and it's this. Seeing and understanding this sign and jumping into action could potentially help you save somebody's life. If you see someone choking, you want to perform the Heimlich maneuver. So you want to make a fist with one of your hands and place it directly above their belly button, and you want to take your other hand and push firmly inward and upward to help try to expel some of that air and get that object out of their airway so that way they can breathe again. If you're choking, you can actually perform the Heimlich on yourself. You're going to do that same step that I just showed you, but you're going to want to sit down in a chair to give yourself some stability and keep going until that object is expelled from your throat and you can breathe again. Knowing basic first aid techniques is awesome. But not all emergencies require techniques like that. Sometimes an emergency can be handled by something you'd have in just a simple basic first aid kit. If you don't have a basic first aid kit, it's a good idea to go out and buy one or two and keep them in a place that's easily accessible in case of emergencies, on top of a fridge, in your car, or even keep a small one in your backpack. Some notable things that you could keep in your first aid kit are antiseptic wipes, pain relievers, a CPR mask so you can safely give mouth to mouth, gauze, antibiotic ointment, band-aids, really anything. Having a basic first aid kit on hand is awesome, but it is still so important to get safely trained in CPR and basic first aid. In conclusion, basic first aid isn't just a set of skills. It gives you the potential to jump in and help somebody in a life or death situation. So, I encourage you, go get trained, learn CPR, learn basic first aid. Because as they say, the best time to know basic first aid is before you need it.